Progress with another video for you guys. So today the topic is going to be sciatica, another topic that doesn't tend to need a long introduction for anyone who's had it, and certainly can take you out of the game for a while. You know, whether you're trying to just make gains in the weight room, whether you're trying to just get back to life, get back to work, play with your kids, things like that. It can really be a debilitating pain, and most people tend to experience it kind of in the back of this leg area here, sometimes down into the foot. Many times it can be associated with a disc herniation, and those herniations can, many times come from the lower back, typically around L5, S1, which is that lowest lumbar area. So I'm going to kind of give all the spiel at the end as far as, who I could think this could help, when to do it, and, when to get checked out and all that. Obviously, though, as a rule of thumb, you should probably always get checked out if you're, even remotely concerned about it. But for some of the more minor things, some of the more things that have happened maybe pretty recently, hopefully you'll get some help with some of this stuff. I've had some pretty good results with it, but it never hurts to get a second set of eyes on you. A lot of the videos that I was watching, I was seeing a lot of those positional strategies, and then they just kind of cut you loose. And so what I want to show, though, is once you get yourself and those symptoms reined in, how do you stay that way? Because these things definitely can recur. So hopefully this way it'll keep it at arm's length so it doesn't keep coming back to haunt you. Okay, so the first thing I'm going to show you guys is something that's called the McKenzie, or some people call them Browder extensions. And so what I'm doing is I'm laying face down on the mat. Now, depending on how irritable your symptoms are, being down here by itself might be a tall order. So if that's increasing your symptoms, you can always get something and put this underneath your belly. So in this case, I'm just going to use a blanket, towels or pillows. If you have a bolster or a wedge, that's fine. And then from there, you can just lay here and just do some deep belly breaths. Almost think about pushing your belly kind of into that blanket or towel or whatever is underneath you. And keep your head heavy on the mat too if you can, because if your head's up here, and those paraspinal muscles are just kind of going to be kicking in to keep you there. So just try to turn everything off if you can. Nice deep breaths through your belly. As you inhale, you want to sort of push your belly into that towel or blanket, in this case. Okay. And ideally, as you're doing that, you should be feeling, some alleviation of your symptoms, or at the very least, not getting any worse. If your symptoms are intensifying, this might not be the best position for you. But if it's working for you and you're kind of relaxing into it and your symptoms are getting better, then that's great. And, perhaps in the moment or definitely on another day, hopefully you can work your way back down to the mat. So it maybe might take a few days to get there. It really depends on how irritable your symptoms are. It's going to be a little different for everybody. When in doubt, though, I wouldn't try to push it early before you think you might be ready. But once you can, you can hopefully get the wedge out of there again, and then just be able to do some belly breathing down here, okay? Once you feel like that's tolerable for you, or maybe even alleviating your symptoms a little bit, you're starting to feel a little bit better, then you can go up into a little bit of an extension. And the thing to note here is I'm not doing all the work with my back, so I'm definitely not doing one of those, Superman maneuvers. I'm pretty much doing all the work with my arms. And so I'm just going to lift, kind of just gently peel my chest off the mat as I go up and down here, okay? And so ideally you're keeping your glutes, your legs, pretty much the low back, trying to keep that pretty much relaxed, and then just moving the arms. And as far as the count on these, if your symptoms are getting better and you're feeling pretty good, and you're feeling your symptoms, maybe work their way out of your leg into your buttock area, that's a good sign. If your symptoms are working their way down towards your foot or intensifying, it's getting stronger, and that's not a good sign. So you don't want to be, going after that too much. What I would say is just stop that exercise, certainly if it's getting worse. There's some other ways you can try this. Now, if you're getting better though, you can, keep going for a little while. Usually the count on these somewhere between 10 and 20 is pretty good. If you're feeling better and you want to do a little more than 20, that's fine. If you're not really sure how things are feeling and you can't really tell if you're getting better, I wouldn't go to town on this, maybe just like 10, 15, because again, you could be possibly irritating that nerve. So you want to make sure that, later on that day, you're still feeling pretty good. The next day, you're not feeling too much worse. And then if things are, if all's well, then you can try to up the ante maybe a little bit next time. But when in doubt in the beginning, I'd go easy on this because nerves are pretty easy to flare up and they can take a while to calm down. So this is a little different than your traditional strength, exercise where you can kind of push through some things. I wouldn't really push through any of this stuff because nerves are definitely finicky. The other way you can try and do this too is you can experiment with your hip positioning a little bit, okay? So if you want, you can use one of those blankets to kind of wedge yourself in here. So if my symptomatic side was down here, you might get a little relief from being here. And again, you could do your belly breathing down here, just kind of go through the series again So pretty much that whole thing with just one side. Some people might get some relief doing that, okay? And again, you can also experiment with the position of your leg. So if I move this out of the way, you can move your leg a little higher or lower. There's no real magic way to do this. But again, I can do the same thing. Come down here, do some belly breathing, come down here, eventually progress to some extensions. So you might, for some people, for instance, they might feel, they can tolerate it down here. Once they come up here, it doesn't feel so great. So, just go with whatever window you can kind of work that feels like it's alleviating your symptoms. Again, there's no perfect way to do this. The way your disc might have herniated could be a little different in the way it's putting pressure on the nerve. So, you kind of have to experiment with some of this stuff. And that's why sometimes you need to have a second pair of eyes on you. But if you can play around with it and get it to work for you, then awesome. I've had some pretty good results with some of these positions, so give them a try. Okay, so another one of the tried and true positional strategies that can work for a lot of patients is just doing a single or a double kneaded chest. So it's pretty much what it sounds like. Nothing too fancy at all with this. You're just gonna lay on your back, and then from there, if this is my irritable side, you could try to bring that knee kind of up into your chest. Ideally, keep this leg kind of relaxed, and then again, just take some nice deep breath through your belly if you can. Same kind of thing though, if this is irritating your symptoms in your leg, getting more intense in the foot, don't force it. You can kind of come a little bit lighter versus kind of bringing it up high, as long as there's no pinching in the hip here, and just take some breath through your belly. Some people might feel better coming up here with both. You can kind of come wide versus a little closer, depending on what feels good for you, okay? You can clasp your fingers sort of together here, or even in the back of the knee if you have knee pain, coming back here could also be fine. And then the last part of this, just go ahead and do some real gentle rocking back and forth, okay? Sometimes that'll help some of those muscles to kind of unwind and relax a little bit. And if you can do that, then the next thing you can sometimes try is bring your legs down, and then from there do a little bit of rocking in that position, okay? And in the beginning here, you can just kind of work a small window like I am, where I'm going just a couple inches in each direction, and then gradually in time, you might be able to go a little farther, okay? And again, as long as you're not having any symptoms, then great. The other thing you can experiment with is, if you're starting to cramp up or something's not feeling good, you can play around with your foot positioning or the width a little bit. Just try to find a position that allows you to feel like you're kind of relaxing into it. You don't want your body to feel like you're having to kind of fight against this, like it's tough to get over there. Ideally just find a nice comfortable window, and hopefully in time you can just kind of gradually go side to side. Okay, just real easy. You're not trying to go too quickly or ballistically here. I wouldn't do this version where people are doing this kind of windshield wiper thing. That's going to be a lot of torque on the back. So just keep those feet kind of nice and heavy on the floor, and just kind of go here, okay? And so again, that series would be, maybe a single kneaded chest, and you might even have to just hang up. You might even just have to hang out for a while in that kind of single and double kneaded chest phase. It may take a while before you can get up to the rocking positions, but if you can do that, then definitely more power to you. Okay, so third position I want to talk about is something that's going to a little bit of traction in the low back. So you're just going to lay on something like this and just kind of stretch out a little bit, okay? So once again, my legs are pretty heavy on the ground, arms are kind of heavy on here. This ball is not a really big one, and it's also not extremely firm. You can experiment with the size of the ball a little bit. Ideally though, you just want to be pretty much relaxed in this position. So just take some nice deep breaths through your belly. This is kind of similar to when I had the blanket underneath me earlier. Just a little more of an aggressive way, because I'm going to have a little more of the weight of my legs now kind of pulling here, just to give my back a little bit of traction, okay? So you can experiment with what, position feels right. You can kind of come back a little bit more versus, a little more forward. See what feels good. Just try to relax into this as best you can. I also have a chair here just to show that sometimes people will like to do this if they have their hands up kind of here, and they can kind of just take some deep breaths through their belly this way. So that stuff sort of looks like a child's pose for those of you who are familiar with yoga. A child's pose is essentially just going to be, where you're down here, kind of lean back on your heels and come down into this position. Now some people with knee pain don't tolerate that as well. Sometimes people are going to be too flexed here or just too inflexible to get down very far, and so they can't really relax into this. And for many people who have a disc herniation, flexion can bother their back, so not everybody will tolerate a full child's pose right off the bat. If you can, then more power to you. Once again, as long as it's not irritating your leg. Sometimes the ball though can be an easier place to start. If the chair thing works for you to give you extra traction, then that's great too. Some people that have a door, you can also hang above, like if you have a bar above a door, you can certainly hang above that, and sometimes that'll give your low back a little more traction. So a couple of ways you can experiment with this. Sometimes I'm hanging above a door, I'll kind of lean to one side versus the other too, and sometimes I can open up one side a little bit better. So that's definitely something you can also play around with. Okay, so as far as some of the exercises to strengthen the muscles around your back that kind of support you like a corset, that's definitely something you want to try to get into if you can. Step one is obviously to try to alleviate your symptoms. Anyone who's in pain doesn't want to be in pain. And so the first box to check off your list is to see if you can reduce some of that symptom intensity. But what you also want to do is marry that together with some exercise that will hopefully keep you there. And so all those positions I just showed are great because they can alleviate your symptoms, but they're not necessarily going to keep you there because they're not really strengthening anything, they're not changing anything about your body really, other than just reducing sort of the irritability around the nerve, trying to get some of that disc to move off the nerve hopefully, but it's not necessarily going to prevent it from coming back to haunt you again. So here's some easy exercises you can also try to incorporate. Okay, so a good exercise you can try, which you may remember for those of you who watched my glute video, is just a real simple hip bridge, okay? Now the only difference when you're doing it for a sciatica is you might have to be a little more mindful of your leg position. So you might need to go a little farther versus a little closer. Typically closer is probably going to be a little bit better for you though, and you may not be able to go as high. So sometimes for some of you, just doing kind of a real, pelvic tilt maybe, just a real small tilt, maybe barely a lift at all, that could be a starting point for some of you. And then hopefully eventually in time, you're starting to notice that, oh hey, I'm gradually getting up and down a little bit higher, okay? Sometimes people can bias their glutes a little more when they put their feet together and move their knees apart a little bit. So you can try it from there as well. As long as it just feels like it's muscle working and not, again, aggravating those symptoms, then that's a pretty good exercise to try and incorporate into the mixture. Okay, so two other great exercises take place on all fours, what we call quadruped or a tabletop position. And so what I'm going to do for this one is come into all fours, and again, the way I typically get set on this, hands are sort of in front of my chest, and my knees kind of fall in line right behind my hands. A lot of times people kind of are here. Try to come a little wider because that's going to ask your muscles in your midsection to hold you a little bit more. And for those of you that are more symptomatic, you can certainly start with just an arm lift. So you might want to just kind of move your arms one at a time. And that certainly is a fine place to start. The next thing you could try and do is one leg at a time, okay? And again, you may not even be able to go very high with this one, and that's totally fine also. So you may actually just, kind of do a partial one on that bad side, that's okay. And then hopefully eventually in time, you can get to where your leg is pretty much fully extended, okay? So ideally you want to have your core braced, not really be moving a lot in this position. So this is one of those things I showed in my glute video, but this is just going to be without any resistance. We're just doing this with body weight right now. You can also play around a little bit with how your angle is here. So you might want to go back over your hips a little more in the beginning if you're pretty irritable. Now another one I like to show people in that quadruped, that same position, is the cat camel, which typically is just going to involve you moving the center of your spine up toward the ceiling and then kind of back down towards the floor. Now usually I'll just kind of allow my head to follow my torso. So as my torso goes up, my head kind of falls opposite, goes down, and then as my torso goes down, my head kind of just moves up. And I'm not trying to really force it up, I'm just trying to easily just follow my body here. And again, with this movement, I'm not really trying to force myself to go real far. I'm just working a comfortable window, whatever you can tolerate, okay? And for some of you, again, that are pretty irritable, even just a small movement here can be fine, or even just a little bit of rocking in the beginning might be fine, okay? And again, if you're having issues with your wrists, you can always hold on to a dumbbell or make a fist, and that might be a little bit more comfortable for you. Okay, so that's just a few simple concepts on how you can try to address sciatica for those of you who are having it. Again, though, there are reasons why it may not work for you, and again, depending on how the disc is herniated, how large it is, what might be, potentially putting pressure on that nerve. It may not even be a disc. It could be something like an osteophyte or a bone spur. So, when in doubt, again, you want to get checked out on this. If these positions work for you, then that's really awesome. But if you don't feel like you're getting results, you're not getting better, at least after a couple of times, or you're certainly getting worse, I wouldn't hesitate at all on that. Get some imaging, go talk to your orthopedist and see what you need to do about that. Certainly anytime you're having, bowel and bladder problems, more intense symptoms of the foot, anytime you're getting weakness in your foot as well, you want to go get checked out on that, because typically when you're getting weakness, that's indicating that nerve is being damaged, and it may be, getting damaged in a way that's going to be hard to reverse if you don't do something about it soon. So once again, though, these are some positions that hopefully can help. I've had a lot of good success with these. Again, for people who have kind of that more minor sciatica, and particularly when it's in the earlier phase, sometimes it's easier to catch it. When it's been going on for a really long time, it typically is going to be a longer time to kind of get it to go away. I hope it works for you. As usual, feel free to comment at the bottom, let me know what you think. And if you want to see any more of this stuff, definitely subscribe.